Hi everyone, I'm Dr. Stacy Cohen and I am a general and addiction psychiatrist. I'm also the CEO and founder of The Moment. We are a one-stop outpatient mental health and addiction treatment group based in Los Angeles, California, and I'm coming to you from my office in Santa Monica. Also coming to you in sweatpants and my Bear Bee blanket, because these days anything goes. So I wanted to talk to you all about self-care in the era of COVID. I've been a big fan of talking about self-care for a long time now. A little bit of background about me. So I actually started as a surgeon, which I loved and which was pretty awesome, but also as a super rigorous job. And while I loved operating and I thought it was an incredible thing to do, and I think surgeons are frankly heroes, one of the things that was really suffering when I was a surgeon was my self-care. And I learned that for me, getting enough sleep, getting exercise, eating a healthy diet, living sort of a more well-rounded life was necessary for me to be my best self. And it certainly wasn't about not being productive. I actually think that I'm more productive now than I was then because I was just so run down. So, reflecting on my surgery days and stepping back from a really sort of prestigious role that felt good to talk about but didn't feel good to live, really got me sort of working on self-care and recovery and learning to be more compassionate with myself. And so that became a specialty of mine. And now a lot of the work in my practice is giving people permission to feel, giving them permission to take a break, to stop this workaholism thing we're all doing in this country and just to breathe. And right now we're in this very special, sacred, particular time because we're going through a pandemic and people are sort of forced to just stop and breathe and take a break and be kind to themselves. So I just wanted to share a few little tips and tricks of how I'm doing that and how I recommend that people do it during this time. And I like to call these things the gift of the quarantine because at the end of the day, even though there's obviously tons of tragedy going on around us, there's also this opportunity to get back to basics and sort of stop this chaos that we've been living in and figure out what really matters and also take some very precious special time to ourselves. So whenever there's a chaotic, tragic change or major change, we have a tendency as humans to sort of go from one pole or to the opposite pole and to have sort of extreme reactions. So one of the things I'm noticing is that a lot of people feel like they need to get a million things done. And I see a lot of times on social media, people are doing a million do-it-yourself projects. They're getting their house perfectly spick and span. They feel like they need to really conquer the world because, God forbid, they just sit and breathe for a few minutes. Or people are going the total opposite way and they're not brushing their hair for days and they're retreating and they're doing absolutely nothing. And they're freezing. And, neither of those things are probably what's healthy, what's generally healthy. And the answer usually is somewhere in the gray, not in the black or white, but in the gray. So what does that mean in this time? For me, it means picking a few things that I'm going to get done in the day, but not forcing myself to do a million things. So I oftentimes tell people of the 3 things trick, I call it, not a very creative name. But I essentially just tell people, you have this whole list of things you want to get done. Why don't you pick just 3, which by the way is very hard for people. They feel like if they put 3 things over here, they're going to forget all these other, and that's not true. Just put 3 things on a Post-it. I take a Post-it and stick it up on my mirror every morning, and I just pick 3 things I'm going to get done, and believe me, I forget them, and I have to look back at the mirror, and I'm like, oh, I did them, great. Because when you pick 3, you feel like you've been effective enough. You pick 1, maybe not so much. If you pick 5, you end up being overwhelmed and maybe doing nothing. So I just stick to 3. It's a simple number. I try to get them all done. If I don't, it's not the end of the world. Doesn't mean I'm not doing several other things throughout the day, but it's throughout the day. But it's really just an opportunity to commit to doing a few things for myself. And for you guys out there, it might be just throwing in the laundry and calling back your mother and getting through today's emails. It doesn't have to be super hard, but it's just the idea of getting up and moving and activating yourself. Another method I'll use is the Pomodoro Method. And there was a guy who had trouble concentrating in college, and he took a timer that was shaped like a Pomodoro tomato, I guess, and called it the Pomodoro Method. It's worth looking up. And it's something I use with patients and myself, frankly, when I'm having trouble getting done some sort of a mundane or difficult or boring task. I'll set a timer for 25 minutes. That's about all I can last if it's something that I don't really feel like doing. And I'll know that the pressure of the timer will kind of get me focused, and I'll only work on that one thing for 25 minutes. So those are two of my favorite tips and tricks for productivity. You'll notice they're not doing a million things and they're not being productive all day long. It's just 25 minutes. Some other tips for self-care in this era is definitely get outside. We all have different thresholds for what feels comfortable for us in terms of crowd control. So I think it's a really good opportunity to talk to yourself, whether it's via journaling or just sitting and meditating and thinking and deciding, okay, what's my limit? What's my boundary? Will I go for a run? Will I go sit in the park? You don't have to be close to people to go sit in the park. But definitely get outside and get exercise in and get moving. There was actually a big study where they compared Zoloft to exercise for treating anxiety, and exercise in the end did better than Zoloft. So I'm not saying that some people don't need medications. Of course, sometimes people do, but exercise is oftentimes an undervalued form of medicine. So in that particular study, people were doing aerobic exercise 3 times a week for 30 minutes each. So it's totally doable. That might be one of your 3 things on your Post-it. Make sure you're getting enough exercise, sleep, eating properly, eating really colorful foods with lots of nutrients, and just be kind to yourself, because these are unprecedented times. So there's no formula for how to do it. I think it's important to get up and do a few things, but don't overdo it. Really try to live in the gray and live in the middle, and that's where the health usually takes place. So those are my tips and tricks for today. I'm excited to answer some questions via text. And thank you, Barabee, for the opportunity to help everyone kind of cope a little better with these times, and for us to be a little bit more compassionate to ourselves and get back to some basics. Thank you.